So, because of the story that you shared prior to this, and because you mentioned a lot about understanding the story rather than just diagnosing, which I really just admire and appreciate about you. And you always say, well, it's focusing on share what led you to your approach. Was there a particular situation or story that you can share with us?
Definitely, and because I'm a strong believer of the story and how it. So I did my child psychiatry training at Harvard Boston Children's Hospital, and after that, I think the big change that have happened is during my infant psychiatry training, which I did at UMass Boston, and then my toddler psychiatry from 0 to 3 organization, and then my parent certification coach, where I have been learning from therapists, from occupational therapists, from school teachers, from parents, from lawyers. Like there were so many different disciplinary that helped me to understand their perspective. And then there were people who are, the perinatal expert. So all those things helped me to understand more at a deeper level. So as far as the how this all knowledge one day really make me believe that I'm glad that I went through all that rigorous training. I was seeing this child, I believe 12-year-old, came with, I would say, 4 different diagnoses: conduct disorder, intermittent explosive disorder, bipolar disorder, oppositional defiant disorder, attention deficit hyperactivity disorders. Already tried 5 or 6 different medication, including the hardcore antipsychotic risperidone, aripiprazole, Prozac, Lexapro, even a mood stabilizer, and now got hospitalized multiple times for aggressive behavior towards self. So I can see why the previous child psychiatrists, therapists have put all those, what I would respectfully say, labels, and why they tried all those medications. And when I met mom first time, so mom shared all, the child was mean, aggressive, tried to choke his younger brother who was a couple of months old, and he did not have any remorse. And then he was cruel towards cat, and he used to kick whenever he got upset. And, it was too much shame to bring him in the community because he get into fight. So I can see why there were so many labels. And so when I get all that information, and then I asked mom, why not let's start from about you, about the pregnancy, about the delivery, and walk me through. And mom said, yeah, pregnancy was fine, delivery was okay, he was pretty healthy child. And with the infant psychiatry, what I have learned is, the normal sometimes doesn't mean normal. And so I asked her, was there any stress during pregnancy? And mom said, what do you mean about the stress? I said, any financial stress? Did you have any loss around that time? I mean, I have, so many stories when parents were pregnant and they have lost a significant one, and how much, especially another case where, the mother lost her mom very suddenly when she was pregnant, and how much that affect throughout the pregnancy. Anyhow, so loss during the pregnancy, relationship issues, domestic violence. I cannot even tell you how many times that have come. Quote unquote, pregnancy was normal. But when I asked this specific question, so no, mom took a pause, and that's what she shared. She said she was in, I think, 17-year-old or 18-year-old, 17, I believe, 16 or 17-year-old. She was taking birth control pill, but with the she was doing job and there was not enough money, and she was missing her appointment, so not consistent with the birth control. She had a boyfriend, and she was having some lower belly pain which was not going away. People were thinking it may be UTI, the urinary tract infection. They did an ultrasound, and ultrasound found out that she was a couple of weeks pregnant. So when she told her boyfriend, I mean, he just left, because she wanted to continue, because it just seemed wrong to her to get an abortion. So the boyfriend left, and she continued the pregnancy, and she remember, that she finished her high school, went to college, she did a lot of degrees, but she had to leave her child with so many different caregivers because she doesn't have a lot of money. So it is very whoever is available. Then there were boyfriends after a couple of who were not nice to him. Like one time she remember, the baby was crying throughout the night, and she just have this boyfriend who have history of some drug use, and he tried to, you know, cover his mouth with his hand so that he stopped crying. And then mom started crying, and then she was telling how sometimes she used to hit him, used to get mad at him because she was going through so much tough time, and no was she doesn't have any sport, she didn't have any sport. And how the domestic violence have happened to her, and he witnessed all those violence, people were not nice to her, and there and then he was witnessing all those things. And then when I asked about the conduct disorder, she said, yeah, I told the previous psychiatrist that he tried to choke the 2-month-old brother, who was not stop crying. And then he was upset with the he was not nice to the cat. And with my infant and all that knowledge, I know that neurons that wires together, mean when he was upset, someone choke him, someone stop him, someone kick him. So what he learned, whenever the other person doesn't listen, you choke, you kick, you hit. It's not that he doesn't have the remorse, he does not know how to cope with that. So over time, when the mom was sharing the story, and this is the so-called mom who has been non-compliant with the treatment, she did not follow through. The child has been, that's the other in the chart review, that the child has a history of not taking the medication and then getting admitted. And the reason, what mom was telling, that she didn't believe the psychiatrist or the psychologist, they were understanding her or the child. They were just putting different label, they were just changing the medication, adding different thing. And this is the first time she felt understood. She realized, yes, he was struggling with ADHD, with a significant trauma that he was going through, she was going through when she was raising him. So over time, we clarify the diagnosis, we cut down his medication, we treated him with a trauma-focused cognitive behavioral therapy. We found a really good therapist. We get rid of the antipsychotic medication. The other sad part, which I teach and emphasize to a lot of my students and trainees, the lot of these antipsychotics medication, risperidone, aripiprazole, they block the dopamine, which is the pleasure hormone in our brain. So I feel, it just makes me feel so sad that, the child is struggling with trauma and you are taking away whatever the pleasure in the brain is with these medication. These are really good medication. I'm not saying, I have so many kids on these medication. Whenever they need it for mood dysregulation or other thing, yes, but not, just to calm them down without understanding the full story. These are really good medication. When you understand and you realize this child is struggling with significant behavioral issues because of the autism, intellectual disability, disruptive mood dysregulation disorder, these medications are very helpful. But in many cases, we are not doing the due justice because of not understanding the story. So this mother have been consistent with the treatment, regular with the appointment. We cut down the medication. The child is excelling. So that's where I really felt good. I'm glad, that that I have learned, and I'm glad that it has helpful, with the family and so many other families as well.
Yeah, what a powerful share. I found myself just so captivated by what you were sharing. Like I was, as a mom, I was going through that emotional roller coaster, and that's immediately what came up for me. Like I don't feel like, as a mom, she was being heard. And it wasn't that she wasn't being compliant. She just didn't think that they were really listening to her. So these medications and all these things, she was watching her child and not get better, but not be in a good place. And so I'm overjoyed that she found you, and how, what a blessing that is. And as I always say, I just truly, truly, truly hope that these videos reach our clinicians, that that can just see a different side and how much of a difference this makes. So thank you for sharing that with me today.
No, thank you for having me.